All right, I think we can go ahead and get started. Thank you so much for taking the time to join us today. My name is Sakani Chambo, and I serve as the Volunteer Engagement Specialist for Global Care Force, and I will be your host for today's call. And the goal of today is just to give you a high-level overview of who Global Care Force is, what we do, and how exactly you can join us. So before we start, I just want to go over some housekeeping items with you. This call is being recorded for future use. I will send you a link after this with the link, an email with the link to sign up, as well as the link to rewatch this recording in case you just wanted to go back and get that information again. And we ask that you please keep yourself muted until the very end of the call when we do a Q&A, just so that we don't have any interference as we present. So with that, we can go ahead and dive right in. So who is Global Care Force? Our purpose is to transform lives through volunteering, and we work to connect volunteers with other organizations worldwide that are serving those with different types of need. We have medical volunteer opportunities as well as non-medical volunteer opportunities. Our volunteers serve without distinction, and we always work with respect for other cultures and other faiths. And our goal is to continue to provide primary care teams to areas lacking access to medical care. And we are a 501c3 registered nonprofit. Where do we serve? So we send mobile medical clinics to Egypt, Jordan, and Ukraine. And then Steve, who we'll be hearing from in a little bit, just served in the inaugural. I'm from South Africa, and I keep saying inaugural. That's how I pronounce it. And everyone keeps saying, oh, we send all girls teams, but inaugural team. They were in Egypt, and we're going to hear a little more about their volunteer experience. We also send volunteers to the southern border to do medical and non-medical volunteering in the shelters in El Paso, Texas. And then we have a partnership with Missionaries of Charity, which is Mother Teresa's order, working in homeless shelters and hospices in Gallup, New Mexico, Rosarito and Tijuana, Mexico, and in San Francisco, California. And so now I would like to invite Anna and Steve to share a little bit about themselves. I muted you, so if you can please unmute yourselves. And before I get into the specific questions, can you just tell us a little bit about who you are, where you're from, and what is it that you do?
Well, I'm originally from Wisconsin and moved to Germany, and that's where I met Steve. We have a family of 3 grown boys and 2 granddaughters. We now live in Buffalo, New York, and I'm a registered nurse. My field of expertise was OB, maternal child health nursing, and I did some school nursing, and I'm now retired since we've moved here. I've been on many missions with other organizations. I've been to Haiti twice, to Costa Rica 3 times, and El Salvador once. And before Global Care Force was an entity, they were COVID Care Force. And with them, I went to Mississippi and Oklahoma to do vaccines during COVID.
Awesome. And Steve, do you want to share a little bit about what you do?
I'm a retired family physician. I trained in the Army and did 6 years active duty, and then did a private practice in upstate New York, which is pretty much where I'm from. I'm retired now for about 2 years. I've done missions with Ann, basically those same places. Several trips to Ukraine, El Paso, most recently Egypt, and definitely enjoy volunteering.
And what made you decide to volunteer with Global Care Force in the locations that you have served? Because you have served with us in quite a few different places.
When Ann and I went to Haiti, we went with a group called Heart to Heart, which was founded by Gary Morsch. And when and came across the Global Care looking for volunteer work down in
Well, that was
giving COVID shots,
yeah, when
right?
it was COVID care. And after COVID changed, I started getting emails from Global Care Force about going to Ukraine. And Steve had been very, very interested in being able to go to Ukraine to help. And that is what got us so involved with Global Care Force was he was on the inaugural team to Ukraine.
But finding out, I mean, knowing it was, I really like the way that Gary Morse kind of runs the organizations. And so that was one thing that kind of attracted us to Global Care. So.
Okay. And can you share a story with us about someone that you met or something that happened during one of your volunteer experiences with us that will stay with you for the rest of your life?
Well, yeah.
Yeah. One thing that really stuck with me was our last trip to Ukraine. We went to an area that had just recently been liberated from the Russians down near Kherson. And we worked in a clinic that was basically run by a woman, and to be about our age, who was an EMT, pretty much acted as a town doctor. And during the occupation by the Russians, she had been kicked out of the clinic, and they used her clinic as a barracks. And she had to pretty much put her life on the line to kind of sneak around town and give care to the residents without being discovered by the Russians. So that was a real impressive story. And she was so happy to see us. So we were just so happy to make her acquaintance and see what a dedicated person she was. So
Yeah, wow.
With me.
That sounds incredible. And Andy, you have your own story that you would like to share?
Well, it's mostly just people coming in who just so need help. There was this last trip in Egypt, we were working with Sudanese refugees, and these are people who have been evacuated to Cairo. Their husbands, we saw many women with children, their husbands are still in Sudan. They have no idea if they're dead or alive. But there was one young woman I took care of with a baby who was less than 3 months old. And I took one look at her and the baby and knew that this baby was very sick. Just respirations that were so rapid that I couldn't even count retracting, and got her to see the Egyptian doctor. And he said, this child is so sick, needs to go to the hospital. And basically it was, she didn't have money to go to the hospital. And, Global Care Force was able to assist her in being able to get her child treated. And it was just so overwhelming that day, because we had seen so many kids and so many people who just had gone through so much trauma, and then this poor sick baby. So that day that really has stuck with me.
Absolutely. And you were on the first team ever that went to Egypt, and we're trying to recruit more volunteers to go there. So can you explain what a typical day in the life of a volunteer on the ground in Egypt looks like?
Well, we had some pretty basic rooms that we stayed in. We get up and the second place we stayed at, there was a woman there who made our breakfast. So all the volunteers ate breakfast together. We had quite a trip to our clinic. Through the scariest part of the entire trip was like streets, like driving and crossing the street, because the traffic is it flows like a river. It doesn't.
That's one way to describe it.
It's not like you would expect anyway. So then once we got to the clinics, we would set up. In Egypt, we were really fortunate that we stayed in a few clinics for more than one day, so we didn't have to tear down every day. We would get the clinics ready, get pharmacy ready, situate our room. There's times when we're in one great big room, times when we are in community centers that have little rooms where the doctors can be. So we figure out how we're going to situate our rooms so that everybody can hear and has some amount of privacy. we have a great logistical person who is working everything, trying to keep everything flowing, plus going out to get us lunch. So it was a long day, and because the traffic in Cairo was so terrible, it was very congested. So we would generally eat on our way home, and a few nights it was just too tiring, so we ordered out and had it brought in and ate at the place we were staying at. But basically, we're pretty much all stayed together. You really get to know your team, the people you're working with. We had translators, and they often, when we did go to dinner after work, they would go with us. So we really got to know everybody, and we're a real solid team. But if I had to say one thing about your day is flexibility, because things are always changing, just how many patients are coming in. Steve went out for several home visits, which let us down a doctor. So you just kind of have to rearrange things. So being flexible is the big thing.
Absolutely. And you touched a little bit on this when you were talking about how the team comes together. Our volunteers come together as strangers, and we've noticed in the different locations, they tend to leave as friends. So can you tell us about what your experience of teamwork was like, and what was the support that you received from the local staff and the translators as well?
Yeah, I would say every single trip I've been on, we've developed a camaraderie. I think when you have a team thrown into kind of a difficult situation, one, you don't know what to expect. So you're all kind of equally nervous. And, resources, you don't always have the resources you need. Global Care does a good job of getting us, most of the medications and supplies that we need, but sometimes, it's a little stressful. You have to kind of improvise, but it does develop a camaraderie. Kind of reminds me of back in the Army, where you have a common mission and everybody works for that, towards that common goal, which is a wonderful feeling. And you do come away from the trips having made some good friends and contacts.
Yeah, there's one physician that I met on my first trip. I didn't go on Steve's first trip. And we're about hoping that she's going to Jordan with us, which would mean it's our third trip going together. So we've stayed in contact, tried to coordinate trips that we're going on so that we're working together again. And we have developed friendships and support system even outside of Global Care Force in our missions.
Yeah, it is quite a unique experience that you go through together. So it makes sense that you form these bonds. And I love that you continue to try and serve together in that way. Volunteering in this way has some very challenging moments and very rewarding moments, from dealing with scary traffic or watching a mother try and deal with getting healthcare for her really sick child. What would you say is the most challenging thing you've experienced on one of our trips, and what has been the most rewarding for you?
I think challenging was in Texas, when we had a gentleman who came in who had not experienced asthma in years and years and years, and got to Texas and was having a terrible asthma attack, couldn't breathe. And we were trying to figure out how to get him medicine, because we couldn't get him to another urgent visit just because of logistics and how much it costs. And Steve just called up the Walgreens, the local Walgreens, said, "Hi, I'm a doctor from New York. Can I prescribe this medication for this person?" And they said, "Oh, sure, that's fine. Give us your doctor number." And they went ahead and filled that prescription. And Iris, who was our logistics person on that trip, was able to get the funding and take care of it so that this man could get his medication. So I just felt really good about how we all came together. Had Roxanne on the phone, being able to figure out what we could do for this man. So I thought that was just a real success.
Yeah, I don't know. Now, working in a foreign country, it was a lot easier as far as prescribing. Working in Texas without a Texas license. That was one of the challenges that we had as far as what we could prescribe. But certainly one of the most challenging things for me was when you're in an area where the formulary might be limited or the patient's resources might be limited. Sometimes you almost have to tailor your differential diagnosis or your diagnoses to what can you actually treat and what can the patient actually accomplish as far as diagnostic workup, that type of thing. You really have to make your best clinical judgment on, here in the States. I mean, you can order whatever you wanted, and everything down there. You really have to depend on your history and physical and what's available, what you have available to treat the patient with. And then the formulary is very good that Global Care provides, but every trip we kind of debrief and say what we'd like to add. But again, that's a challenge to kind of shift from the way you practice medicine in the States to the way you would practice limited resources.
And what would you say is the most rewarding part of volunteering with us?
For me, it's the adventure and the challenge, going to a new country and seeing a new culture, and again, hoping that the feeling you get from letting people know that they're not forgotten, that that's a great reward.
Yeah.
And I found no matter how much we give in care or medication or our time, we always get so much more back from people. In Ukraine, there were towns we were in that had been totally destroyed by the Russians. Everything was taken from these people. If they couldn't steal it, they broke it or burned it. And still these people came in with us, giving us gifts. I have a couple of books of poetry. One of the providers saw a poet and she brought poetry books. One little woman brought in a huge bag of walnuts. It was just whatever that they had, they brought to give to us to show how much they appreciated us.
Mm-hmm. Yeah, Ukrainian people are very generous and welcoming people. Some people might not. Oh, go ahead.
I'm sorry. I just wanted to add one thing about our translators in Egypt. They were very spiritual, Coptic Christians. And several times I would leave the room and my translator would ask, can I pray with for the patient? And she would pray with the patient while I was out getting medication for the patient or getting something I needed. And I'd come back and the patient said, I don't need the medicine. I feel a lot better. So I think that, for dealing with a lot of the things we saw, I'm sure were related to PTSD. And I think the Sudanese were very spiritual too. And just having someone pray over them, I think had a positive effect. And that was impressive.
Yeah. And like I mentioned earlier on, Global Care Force is faith friendly. So we have volunteers that come from many different faith backgrounds and translators, as well as the people that we serve. And we just welcome people of all faiths and also want to make space for that and respect that as well. So I'm glad you got to witness that. Some people might not understand what Global Care Force does. Why do you think the work that we do is important? And if someone asks you why they should support us, what would you tell them?
Well, especially in Ukraine, you've gotten to, you've been there, what now, almost a year and a half, 2 years. And you're going to the same clinics like every 3 months. They depend on you. They realize that you're going to be there. They're getting their medication for the 3 months and know that they will be back. I know Steve went in. The initial trip was September, and then we went back in February and went to some of the same places he had been before, and he saw some of the same patients that he had seen on his first trip. So
different problems, not the same problem.
But there's continuity there. They can depend on that they're going to be able to get their care. So I think that's just outstanding. And that's what we were telling the people in Egypt, is that we would be coming back in 3 months. Not us in particular, but that Global Care was coming back in 3 months. So they got 3 months worth of medication.
Yeah, I do like the model of Global Care. Again, definitely the continuity, I think, is very important. I know some organizations will go in and do something and then will never be back. So the fact that Global Care continues to come back to these places, I think, is a very good model. And I think they do a good job of training, local, or working with local doctors, employing local doctors, and local translators and nurses. Again, I think it makes the communities a little more self-sufficient as well.
And I think one of the things that really impressed me with one of our first trips to Haiti with Global Care, or a Heart to Heart,
yeah.
which has people who have come over to Global Care, was the fact that we're not there as like saviors. We're going in there to help set up their system. We're working within the means that they have. We're not bringing something that they're not going to be able to get again. We are working with the resources they have. We're empowering the people that are there again, the translators were took responsibility to learn more about the medical terminology, because they wanted to come back and serve again. So we're empowering the people that are there and giving them jobs. And, so I just think that part of it was such a learning curve for me, that you're going in not to teach, but to learn.
Mm-hmm. Yeah. Well, thank you so much for your kind words. And thank you for continuing to volunteer with us. I'm very excited to have you be on the inaugural team, also going to Jordan in February. We're very grateful for you. Before I go to explain how the volunteer process works, does anyone have any questions for Steve and Ann while we have them? Dr. Marty?
He's still on mute.
Thanks, Stephen and Ann, for your experiences and sharing those with us. I'm in the stages of considering volunteering and going with Global Care Force. I went to China and Russia back when it was Heart to Heart, back in the 90s with Gary and the crew. I don't know if I've ever met you, but it's possible if you were with Heart to Heart. Yeah. Anyway, I'm a semi-retired psychologist, and I'm not a physician, although I've always worked in medical facilities most of my life. But I've worked with chronic pain and other kinds of psychosomatic problems. So my question is, how do you treat PTSD along with whatever maybe physical infirmities they may have, but they're also have been traumatized? And how do the staff try to, because you're not there for a long time, so sometimes it's just one or two conversations. So how's this been implemented in your experience in the different clinics you've been?
I know in Ukraine, they did set up a mental health team that would travel to different areas. I believe, I could be wrong, but I believe that they do have a mental health worker now traveling with each group. Is that right, Kineke?
That is correct. Lacia provides mental health care each month.
That was that's been since we were last to Ukraine. I did try and introduce some mindfulness. Had some meditations translated into Ukrainian. There's not a whole lot you can do in a 15-20 minute visit, but did try and introduce some mindfulness. Did try and let the people know that they were not forgotten. We did travel with a psychologist our last trip, Trey,
to Ukraine. Yeah.
to Ukraine. That was Trey Bono. And I believe he was setting up a training program. We had a couple of medical students or residents traveling with us in Ukraine, and he was setting up a treatment program, I think, for PTSD. But I don't know what's come of that, but we were fortunate to have him. Now he would take an hour with the patients and would really spend some time more than we could afford.
But even in this quick setting, as a triage person, I got very quickly to know who was good at what. And if I triaged, we triaged a family of with a mom who had a 16-year-old son with cerebral palsy, and he was so small, she carried him like a toddler. And I knew that with her, the most we were going to be able to do would be just to have someone talk to her and spend time with her. And Steve, I sent her to Steve, and when I saw her later in the pharmacy, she just had a huge smile on her face. I just think sometimes the only thing we can do is just listen at the moment. And again, with some of the pain, when they would come in with chronic pain, there were women that I would talk to about just in meditation and things to calm down. I remember one woman who had a lot of anxiety living in her house, and we just talked about things she could do to live in this environment and take time for herself to calm herself down. And she asked a lot of questions. So people are certainly willing to try other things as well.
But I mean, like Ukraine, how do you treat PTSD when it's still going on, when the trauma is still going on? So
well, the overlap between treating PTSD and real involved stress disorders and treating chronic pain, there's a tremendous overlap because it has to do with quieting your brain and changing your neurotransmitter system. So thank you very much for that. And if I go, I'm going to try to get involved in that.
You would be invaluable.
Yeah.
That'd be just so.
Thank you, Dr. Marty. And we have time for one more question. Does anyone, Vanessa?
Oops.
Yeah, I'm a nurse and have been able to do some other volunteer work in the past and looking to kind of get involved in another organization. But my big question is surrounding what you think has been more successful with sustainability, and then what you think has been less successful with sustainability efforts in the areas. That's been, it's always a challenge, I know, but is there things that have worked better and other things that's been struggling with sustainability?
It's still frustrating, treating the chronic diseases. I know in Ukraine, we'd be treating hypertension, diabetes, and patients would, save their medicine, not knowing if someone was going to be coming back. They would take their medications occasionally when they started getting headaches, So still the chronic disease treatment, I think until patients get used to knowing that somebody's going to be back every 3 months, I think it's still going to be a challenge treating the chronic diseases. And we saw some blood pressures that were off the wall just because the patients were on and off their medications. So that's one of the big challenges. What was the second part of the question?
Just this, I think
are sustainable.
Well, even the not being able to sustain it is that sometimes, again, with the flexibility, we weren't, and this was an inaugural trip, so it wasn't so much of a problem, but there was a clinic that we were not able to go to, and we had to switch where we went. And so if we had established being in that clinic, it would have been a problem, not being able to see people who were expecting us to come back. So, just so much depends on what's going on environmentally at the time in Ukraine too, with the war, and where there might be more problems, how you can, avoid traveling over the entire country and staying in one place. I think Global Care has done a lot of, the first time we went, we traveled every single day. The second time we went, we were more clustered and staying in one area and moving in between, so we weren't going such far distances. So that was a good change.
But I think there's a tremendous need for the chronic disease treatment, other things we obviously see in the States, the diabetes, hypertension, heart disease, that as long as global care is committed to coming back every 3 months, I think we can make a real dent in, the treatment of the chronic diseases that we see.
And we do go back to Ukraine every month, actually. And for our teams going to Egypt and Jordan, we send them every other month. So then they'll be getting 60 days medications to make sure that they have enough for that. Anna and Steve, she also asked for the positive you see about the sustainability. So I was like, do you want to speak to that as well?
Well, that was the changing it to being in one area for longer periods of time and not moving every night to a new place that you're going to sleep in, but that you're not spending so much time traveling. So that
Are you referring to Egypt?
No, that was in Ukraine. And well, even
Okay.
in Egypt, we were we only stayed in 2 places, so we were kind of in the same area. We weren't traveling as much, but being able to spend more of our time taking care of people rather than being on the road.
Yeah.
I guess that's the point. That was, a good change that was made, especially in Ukraine the second time we went.
But I mean, to flip the problem on its head, knowing that global care is going to be coming back every 2 to 3 months, and being able to educate the patients that treatment of chronic disease involves a commitment on their part to take their medications every day, and that there will be someone back in 2 to 3 months, whatever the plan is. I mean, to have that commitment is a real positive from global care.
Yeah, and there is a continuous chart, so that's how Steve would know that he saw people from before as well, is that they were building on a chart, so you're going to see what was done before.
Absolutely. Well, thank you so much for your time, Steve and Ann, and thank you for the questions that were posed as well. If you have any other questions, feel free to email us. I will be emailing all of you later with how to volunteer. So to become a volunteer and join in on what Ann and Steve were talking about, the process is for you to sign up on our website. And then you go through the screening process. And once you're placed on a team, you prepare to serve. You'd go through different parts of our learning management system. There's pre-deployment team meetings. And then you deploy and you go and serve. You're on the ground. And then once you come back, we hope that you will advocate on behalf of Global Care Force like Steve and Ann are doing now and spread the word about us. Currently, we have openings for all locations. As I said, we recently started the programs in Egypt and Jordan, so we are particularly looking for people to join over there. Our greatest need is for people to join our team going to Egypt in January. So if you are interested in doing that, please definitely reach out as soon as possible and we can get you started on the screening process. We hold these meetings once a month. Our next meeting is on December 12th. So if you know of anyone who might be interested, or you want to come back and hear some more volunteer stories, please feel free to join us again. Like I said, I will be emailing all of you with the link to rewatch this as well as to sign up to volunteer. Thank you so much for your time and enjoy the rest of your afternoon. Bye.
It's very nice to meet you all and nice to see you.
Thank you, Ann and Steve.
Okay, good luck.
Bye.